Yeah. Yeah. Are we ready? All right. I want to thank you all for coming today. I have two topics that I'd like to discuss. The first topic is going to be on breast cancer and early detection, and the second topic is going to be on image quality of mammograms and on the differences between film screen images and digital images. I'd like to also talk about what we can offer here at Jones Memorial Hospital for mammography, and to talk a little bit about why women should have the exam done. If we start with the why we should have mammograms done, the American Cancer Society tells us that early detection is going to improve treatment of breast cancer. Mammography screening has reduced breast cancer deaths by 63%, and mammography is still considered to be the gold standard of breast imaging. Occasionally, ultrasound and MRIs can be used to assist the radiologist in their interpretation of the mammogram, but are not used alone to diagnose breast cancer. Statistically, the American Cancer Society also provides us with these numbers, and they tell us that every year 260,000 cases of breast cancer are diagnosed annually. They also tell us that 40,000 deaths occur from breast cancer annually, and that 1 in 8 women will get breast cancer in their lifetime, and 1 in 35 will die from breast cancer. Who should have a mammogram? Again, we're going to refer back to the American Cancer Society, and they're going to tell us that any woman over the age of 40 should have a mammogram done annually. They also tell us that from the age of 20 on, that a woman should do a clinical breast exam, have a clinical breast exam done by her healthcare provider every 3 years. It's also important at this time that at the age of 20 you start to do clinical breast exams on yourself to check for lumps and bumps and changes in the breast tissue. It's also important to notice if there's any new dimpling in the skin lines and any change in the nipple to see if it becomes inverted. If any of this happens, at that time you would contact your provider, where they would set you up with a mammogram, and we could check for the detection of breast cancer. There are risk factors associated with breast cancer, and the risk factors are family history of breast cancer, particularly if it's your mother, your sister, or your daughter. Also, a previous diagnosis of breast cancer in one breast will increase your risk. An abnormal breast biopsy, menstruation before the age of 12, and menopause after the age of 55. Giving birth later in life or being childless can increase your risk of breast cancer. Taking hormone replacement therapy and just simply having dense breast tissue can increase your rate of breast cancer. Let's talk a little bit about what a mammogram is now. A mammogram is the x-ray of the breast. There are two types of mammograms that we offer here at Jones Memorial Hospital. The first one is just a screening exam. And as a screening exam, the patients come in, have their mammograms done, the images are given to the radiologist, they're then reviewed, and a letter will be sent to you with the final results. But say you found something on your clinical breast exam, and now you have a lump, you're going to come and have a diagnostic exam done. That diagnostic exam is going to look closely at the area of change that you have felt. We'll take the pictures, show them to the radiologist, and go with his recommendation. Usually if a new lump or bump is felt, then he's going to ask for an ultrasound too to assist in the imaging process. Once the ultrasound is completed, the radiologist will be able to make the determination on whether your breast tissue was normal or whether you should go on and have a breast biopsy done to see if it is breast cancer. What we have to offer at Jones Memorial Hospital is full field digital mammography. We made the change to this in 2007 when we had film screen exams done. We also have a fully accredited department through the ACR. We require our mammographers to be certified, and our doctors have specialty training with reading mammograms. They have to have so many CE credits a year and have to interpret a minimum number of mammograms to continue to read them on an annual basis. There are advantages of digital mammography, and the first advantage is that it's going to reduce the repeat rate of exposure errors. It also reduces repeats due to motion because the exposures are faster. Digital images give us well-balanced compensation of easy and difficult to penetrate portions of the breast, and there's a more natural depiction of areas of low visibility because of light density. Digital mammograms also extend the visible range in areas previously lost due to burnout because of dark density, and edge enhancement to improve the visibility of internal breast structures. Now, all of that sounds quite confusing, but I'm going to show it to you in the next couple slides. I have comparisons. This next slide, as you see in the center, those images are taken digitally, and the images on the outer side are taken with film screen, and they're the same patient. So you can see that the image quality is quite a bit better for the digital images. The doctor's going to be able to find that breast cancer much faster and much smaller. The analog pictures on the outer edges, you can see that they're really gray and almost blurred looking. The next slide is going to talk about that enhanced skin edge. As we referred to the advantages of digital imaging, we talked about burnout. And you can see on the analog picture there, on the left-hand side, that you can't see that skin. The skin was always burned out on film screen exams. On the digital images, on the opposite side, you can see the skin line, the white edge around it, providing the radiologist more information. So when he reviews your mammogram, there's pretty much nothing left not seen. Now the last picture that I'm going to show you is going to talk about that dense breast visualization. Again, same patient. The image on the left-hand side is not as clear, almost hazy looking. Looks as if there's motion in it. But the opposite image is one taken digitally. You can see that there's better penetration and a more even image of the breast. So we've talked a little bit today about who should have a mammogram done, why you should have a mammogram done, and now I want to talk to you about us having it done here. As a patient, if you'd like to call and make an appointment, we have contact information out there. Our phone number is at the top of the slide. When you call and make your appointment, you'll speak right to the secretaries and you can schedule your own exam. It's important to remember that screening exams do not need to have a requisition and that our hours of operation are listed below. We are open early in the morning and later in the evening to help accommodate exams done before and after work. Now the very last slide that I want to show you is actually a picture of our mammography team here at Jones Memorial Hospital. There are 3 of us that are certified mammographers and are willing and happy to take care of you and provide you with a good quality care of exam. Are there any questions?
Dr. Urofsky, please call 5323. Dr. Urofsky,
Thank you.
call 5323.
Actually,
Yeah?
if you wanted to, do you have to be over 40 to come in without doctors?
Yes.
Okay. So you have
do.
to be in those. Okay.
The insurance company won't pay for it if you're under 40. It's best to call.
Okay.
So, any other questions?